Depression is a sense of feeling low in yourself, losing interest in the things that you'd normally enjoy doing. And this is not just for a short space of time, it's for more days than not over at least a 2-week period. Other sort of symptoms that you might experience are things like problems with your appetite, your sleep, loss of libido, lack of interest in the things that you usually enjoy doing, and in severe cases, a sense of utter hopelessness and guilt, and actually not wanting to be here, or thoughts of harming or killing yourself. Well, many patients ask this question, and the concern about causes is it's actually a number, or multifactorial is how we would describe it. It refers to there possibly being a genetic variability. So if there's a family history of someone who's got depression, you as a patient would be at greater risk of developing depression. It's also related to environmental issues, life stresses, things like losing a job, bereavement, illness. So to answer the question of how do patients develop depression, it could be for a number of reasons. The first step that you could take if you think you are depressed is to speak to someone. Often family and friends can be extremely helpful and very supportive. If you find that this isn't very helpful, please speak to or contact your GP. They would often give you greater advice on other forms and access of treatment, such as seeing a psychologist for further talking therapies, or sometimes it's necessary to look at starting medication. For this, either your GP might be happy to do this, or he might refer you on to a psychiatrist and seeing someone like myself. Diet and exercise are hugely important in helping not just treat and prevent depression, but we know as psychiatrists and within the mental health fraternity that patients who suffer with problems like obesity or inactive lifestyles are actually at higher risk of developing disorders like depression. So in order to treat depression, besides using things like talking therapies and medication, we strongly advocate for healthy living changes such as diet and exercise. The benefit to these interventions as well is once a patient reaches a point where they no longer need medication, diet and exercise are extremely helpful in helping patients stay well. My take-home message to patients struggling with depression would have to be, don't suffer in silence. This is a diagnosed medical illness for which we easily can be treated and patients can get the help that they need. This illness can often last only a short time if patients are able to access the necessary help, be it medication or talking therapies, as well as psychosocial support. Patients are often concerned of what the community or others would think. There's a lot of stigma associated with depression. Patients need to understand that this is no longer the case. This is a highly prevalent illness and one that many patients suffer from in silence, which is no longer necessary.